was initially thought that children would be less severely affected by COVID-19 and suffer fewer complications, but pediatricians now say the issue is more complicated. According to Dr Iqbal Karbanee, the number of children getting infected with the virus in South Africa is higher than we think. And while many remain asymptomatic, it's worrying as they could potentially be spreading the virus. There are also reports that children may be more susceptible to newer strains. Dr Karbanee joins me via Zoom now to discuss this further. Thank you very much, Doctor, for your time. So you believe the number of children in South Africa infected with the coronavirus is higher than we think. Why is that?
A lot of these facts about the pandemic are relatively unknown, and we're feeling the way forward as we go along. And I think what we've discovered is that studies are now emerging, and from data internationally, that even though children are less symptomatic and less clinically affected with the disease, they may actually be asymptomatic carriers to a far greater degree than what we've initially thought. And this has major implications for public health as well as general health measures, because it means that, you know, a child may be completely well without any symptoms whatsoever and may still be a carrier of the COVID-19 virus. And I think that's the word of caution. Nobody knows for sure. So unfortunately, we don't have any hard statistical evidence to back this up at this point. But there are emerging indicators that this is a trend we need to be careful of.
So many South African families live together. Parents, grandparents, children, all one big happy family living together for financial reasons or perhaps to assist with childcare requirements. But does this place older family members at significant risk? And what's your advice to those families about safeguarding older members against infection from children who might, as you say, be asymptomatic?
Unfortunately, I mean, it is a feature that is quite predominant in South African society, that often the grandparents are the primary caregivers, in fact, of relatively small children. So it means that, you know, we have to be cognizant of the fact that children may indeed be carriers, and because of that, precautions need to be taken. Children, as soon as they can, wear a mask. I know that the official guidelines make provision for masks only from a certain age. I think it's 5 or 6. But if you can, and I've seen younger children also wearing masks very, very easily and well, they should be encouraged to wear masks, and precautions should be taken even in the home environment to prevent infections spreading to the more susceptible members of the family, which are unfortunately the older members of that family, which may have comorbidities such as hypertension, obesity, etc. So we need to protect those. And I think it also means that even though children are relatively asymptomatic, we should not take off our attention from the precautions that need to be taken at creches and daycare centers as we gradually move to open up the society after this pandemic. So as we move to stage 1, or maybe not immediately, but after Easter, and the fact that there's hopefully no third wave coming, but if there is, then we need to be extra careful with the creche environments and the environments that small children are in to help protect older members of the family.
Let's shift our focus from children to expectant mothers. Government has said that expectant or breastfeeding mothers shouldn't experience any problems with the vaccine, so they can take it. But government hasn't included them in the high-risk groups due to get the vaccine ahead of other citizens. What's your opinion on that?
There's 2 points to the question that you asked. The first point is that, is a vaccine safe for a pregnant or breastfeeding mom? And the answer to that is it depends on what type of vaccine. Now, you get live virus vaccines, and those are generally unsafe for pregnant mothers because they may affect the unborn baby. In this case, the coronavirus vaccine, the COVID-19 vaccine, is not a live virus vaccine. In fact, it's made from an extract of a protein on the COVID-19 envelope. So the virus protein has been purified and then placed into a vaccine, which makes it a lot safer. So definitely it is safer from a pregnancy point of view as well as breastfeeding. Now, the international statistics that we've gathered since the start of this pandemic have shown that the major comorbidities that affect severe outcomes when you have corona include sort of advanced age comorbidities such as hypertension, diabetes, obesity, and heart disease and lung disease. But pregnant mums and breastfeeding mums have been relatively spared. So that's the reason why they're not in the category 1 or the highest risk category at this point. But they do need to be included at some point, but probably lower down the priority list as vaccine usage becomes more widespread.
Dr. Karbanee, would you advise pregnant mothers to get the vaccine just in general, or only those who are high risk due to comorbidities?
I think the higher risk moms should be first in line, but my advice is that everyone who can get a vaccine should get a vaccine, and that includes pregnant moms. So there's no doubt that if you are able to get one, you should definitely have one.
Thank you very much for speaking to us. That was pediatrician Dr. Iqbal Karbanee.